Have you ever got your blood test results back, look at the numbers of ESR and C-Reactive Protein and felt completely confused? Maybe your ESR was high, but your CRP was normal. Maybe your doctor said your lab looks great, but you are waking up stiffer than ever. What do these tests even mean? And why don't they seem to match how you feel? Hi everyone, this is Dr. Ananta Subedi, a board-certified rheumatologist and the founder of the Rheum Doc, as well as Empower Arthritis and Rheumatology Center here in Cary, North Carolina. The villain here isn't your rheumatoid arthritis. It's this confusion, the fear, and the doubt that comes with the diagnosis. It's that horrible feeling of being told your labs are normal when you know deep down that you are not feeling okay. Today, we are tackling the two most common confusing letters in rheumatology, ESR and CRP, also called sedimentation rate and the C-reactive protein. By the end of this video, you will understand what CRP really measures and the most important part, why they often don't match and what to do when they don't match with how you are feeling. Before I go forward, please don't forget a new gift from our team that includes how to make your early morning RA smoothie that will help manage your rheumatoid arthritis better. You can find the recipe in the link below. Now let's first start with the ESR, also called sedimentation rate. And you will see this on your lab report. It stands for erythrocyte sedimentation rate. This is a very fancy name, but let's make it simple. So erythrocyte is just the scientific name for your red blood cells. Sedimentation means how fast something settles to the bottom, and rate means just the speed. So the ESR test measures how fast your red blood cells settle in the bottom of a test tube when they are tested. Now you might ask a question, why do we even care about that test? Well, when you have inflammation in your body from rheumatoid arthritis or any other reasons, your liver makes excess proteins. One of these is called fibrinogen. And you can think of this fibrinogen protein like a glue. It makes your red blood cells stick together in heavy clumps. And what do the heavy things do? They fall faster. So a high ESR or fast settling rate means you might have inflammation somewhere in your body. And here is a key thing to remember about ESR. ESR is old and it is slow. And what does that mean? If I think of ESR as your body weekly weather report, it does not tell what's happening today. It gives you a slow average summary of what had been happening over the last week or two. Is very indirect measurement of the degree of inflammation. To make it easy for you, let me repeat. ESR is old and it is slow, meaning that it goes slowly and stays up for a long period of time. So ESR typically indicate how has been your inflammation the last couple of weeks, not today. And it's also important to understand what else can cause your ESR to be high, not just rheumatoid arthritis. And this includes older age. Some of the older people may also have slightly higher ESR compared to your younger self. Anemia, that is low red blood cell count, also cause high ESR. Sometimes kidney problem and even pregnancy sometimes could increase your ESR. So don't always freak out if you have a high ESR. Always check with your doctors before being concerned about the elevated ESR. So a high ESR does not always automatically mean your RA is flaring. It's just a clue. It's the weekly report of inflammation. Now let's go to the second part, the C-reactive protein or CRP. When you have inflammation, your liver directly makes this protein, the C-reactive protein. It makes it fast and it also sends it right into your bloodstream. Scientists found that CRP is a key part of your body's inflammation alarm system. So if ESR is slow, weekly report, CRP is the daily weather forecast that changes very frequently. And CRP tells us what is happening right now, today, or yesterday. When inflammation starts, your CRP level can shoot up very high, very fast, within even hours. And when the inflammation stops, it drops back down very fast. This makes it a very useful test for us to know what's happening today. So CRP is a newer, faster, and more real-time data regarding how your rheumatoid arthritis is doing compared to ESR. And remember, ESR is old and slow, but CRP is fast. It goes up faster and comes down faster too. So that's why it's a good indicator of your current state of rheumatoid arthritis. But an important thing to remember, CRP is also not very specific just for rheumatoid arthritis. It can be increased by many other conditions, including infections. Even being overweight can also increase your C-reactive protein, and even smoker could have mildly high C-reactive protein. So, just like ESR, a high CRP is a clue, not a diagnostic test. It's the daily forecast. We need to double check what is causing those CRP increase. Always check with your doctor. Now, one of the biggest questions that I always get from my patient is, why don't they match together? Why the ESR and CRP don't go along together? Many of my patients comes to me confused, and they say, my primary care doctor did this blood test, the SID rate and the C-reactive protein, and my CRP is really high, but my ESR is normal. What does that mean? And on the other side, sometimes they also come with me with the question, my ESR is really high, but my CRP is normal. What does that even mean? Now, let me go back to the initial discussion. Those two things, the ESR and CRP, are measuring two different things. That's why they may not always match with each other. Now, let's start with the scenario number one, where your CRP is high, your ESR is normal. And this is relatively very common. And what does that mean? It likely means the inflammation started very recently. The daily forecast, the CRP, caught the storm today. The weekly report ESR has not caught up yet. It's still averaging in all the good weather from the last week. This is common at the very early start of a flare. Now, the scenario number two, high ESR but normal C-reactive protein. And this also happens not uncommon. This could mean you are at the end of a flare. The daily forecast, the CRP, says the storm is over. It dropped back to normal quickly. But the weekly report ESR is still high, and it's slowly trying to change towards normal. And it's still averaging the bad weather from the last few days. Or it could also mean something else is happening, like anemia, or your age is keeping your ESR high even when your RA is not in a flare. So let me quickly recap. If you have a high ESR and a normal CRP, that could mean that you are coming to the close or end of your flare. Or we need to look for other clues that might cause your ESR to be high. Now here comes one of the most toughest and most important question. Many of my patients who come with me with this question, doctor, my lab are normal, but I have real pain. What should I do? And this is one that causes the most fear in a lot of you who are watching this video. Now let me tell you something, all of you RA warriors, please listen to me carefully. And I do believe you. I do believe on what you are telling. And your doctor also need to believe on how you are feeling. And you are not crazy. You are not making it up. Nobody will make up any pain. And your swelling, your hand pain is all real. Your fatigue is all real. And you are the expert of your body. That's why we as doctors need to listen to your body, not just the lab test results. And let me try to make it a little more simple so that you can understand why that happens, why your labs are normal, but you are still hurting. Now, these tests are not perfect. Some people's body just don't make a lot of CRP or ESR, even when the RA is active or RA is flaring. Now, studies like those found in Rheumatology journal show that a large number of people who are active, visible RA can have completely normal inflammatory markers, either SID rate or the C-reactive protein. Some studies even say that up to 30 to 40% of people could have a normal inflammatory markers even with active rheumatoid arthritis. Now, the other important thing to remember is the RA may not always be the villain. Sometimes the pain you are feeling is not from active inflammation. It may not be from rheumatoid arthritis. It could be from fibromyalgia, which is a centralized pain problem, which is very common with rheumatoid arthritis. And you can think of fibromyalgia as like your body's alarm system is stuck on a high alert. Fibromyalgia is very common in rheumatoid arthritis, but it will not raise your SID rate or the C-reactive protein. It could be a damage from the old past inflammation. If there is a damage due to rheumatoid arthritis, your sedimentation rate, your C-reactive protein will be normal. That means your RA is not very active and your pain is coming from joint damage, not from inflammation. And it could also mean your pain might be coming from osteoarthritis, which is an wear and tear arthritis, very different from rheumatoid arthritis. Now, this is where we need need to stop looking at just the lab results and start looking for the whole person view. Your doctor need to take a good history, good physical exam so that we can understand what is the real cause of your pain. Is it rheumatoid arthritis versus other condition like fibromyalgia or osteoarthritis? So let me sum up. The C-Reactive and the C-Reactive protein are just the compass. They are not the map. They help you as your guide, understand the type of inflammation, but you hold the map. Your story of your pain, your stiffness, your fatigue, this is the real map we need to follow. So if you are having a lot of pain, you are having normal lab, don't just give up. We need to understand better what is the source of your pain so that we can try to make you feel better. Now, all of you RA warriors, thank you so much for watching so far. If you haven't already got the RA smoothie that will help you manage your rheumatoid arthritis when you wake up in the morning, don't forget to get the recipe in the description below. Now, let me quickly recap what we talked today. We talked about two things today, the ESR or erythrocyte sedimentation rate and the C-Reactive protein. And we talk about ESR is the weekly report of your RA forecast. It is slow to change and stays there for a longer period of time. The C-Reactive protein is a daily forecast of how your RA is doing. It goes up fast and also come down fast. And sometimes they may not match together. One might go up, other might stay normal. But the most important thing, you can have normal lab, but you can have real pain. And you are not crazy. You are not making it up. Your doctor need to believe on your pain, and your story, your feeling is most important thing that will help us guide on how to manage those pain conditions. And if you think of our NESSCAR framework, the NESSCAR, talking about nutrition, exercise, sleep, stress management, checkpoint, and this is come the checkpoint where we need to check those numbers to help us guide how your RA is doing, but they don't always tell the whole story. That's why we need to look at your whole person so that we can understand and manage your rheumatoid arthritis better. So don't forget your NESSCAR framework that will help you manage your RA better. Now, let me quickly summarize our 3 important action items from today. So the step number 1 is become the expert witness. For the next 7 days, I wanted to start a symptom journal, not just the lab journal, a symptom journal that will help you understand better how you are feeling. Write down 3 things every day. Your morning stiffness in minutes, how long they last. Your pain level from 0 to 10, how much pain do you have every day? And your energy level, 0 to 10, how do you feel about your energy? The journal is your data. This is the most important test results that matter the most. And this will also guide your doctors to help you how to help you. This is your real map to help you feel better. So make sure you always journal your symptoms, including pain, stiffness, and energy level. And number 2, add at least 1 anti-inflammatory diet today. You may not be able to control the CRP number, but you can control what's on your plate. Just one thing. Today, add 1 handful of spinach to your smoothie, or eat a handful of blueberries, or have 1 piece of fatty fish like a salmon. This is a small, powerful step to fight inflammation from the inside out. And this is part of our NESSCAR framework. And number 3, connect with one person that you love. Feeling confused and invalidated is lonely. The villain here is the fear, the confusion, and they want you to be lonely. But fight against that villain. Your mission today is to connect. Call a friend, hug a family member, or comment below on this video so that you feel connected with our community. Tell us how you have felt today. Are you confused or are you more clear about your lab results? When you share your story, you will see hundreds of other RA warriors who feel the exact same symptom. And you are not alone. This is our 4F value of friends and family. If this video brought you some clarity and hope, please subscribe to the channel and ring that bell so that you never miss a video from us. And don't forget to download the free No More RA smoothie in the description below. It will help you fight against inflammation every morning. Now, all of you RA warriors, let's work together. Let's keep our community together, and let's move from pain to the possibility, and let's move from confusion to clarity. I'll see you in the next video. Bye-bye.